My name is Elaine Wolf, and I'm the Chief Nursing Officer for Harney District Hospital in Burns, Oregon. Burns is located in southeastern Oregon, but our hospital actually serves the entire county. It is also one of the largest counties in the whole country. What I love most about being a nurse in a rural community is that we aren't so specialized here. We get to be generalists and work in different areas and expand our skills in that way. It's a bit of a challenge sometimes for some nurses to have such a wide variation in their skills in that way and be good at it. And that's a challenge for us here. Being a nurse in a rural community is different because we are just farther away from everything. And I think that's why teamwork and the cohesiveness of the team is just so much more important here, because we lean on each other and we rely on each other to provide the best possible care we can for our patients. A typical day for me is probably very similar to a lot of administrators. I check my schedule and check my emails, and I do come in early in the morning sometimes so I can catch night shift. And sometimes I help with patient care. It's not a lot of administrators who still work at the bedside, but here sometimes when the need arises and there's just nobody else to help, I get to work closely with the staff and still get my fix with patient care and see things at the at that level and see how the work that I do affects nursing in a broader sense. Harney District Hospital has a great relationship with OHSU's nursing program. It allows us the ability to work with their wonderful students and showcase what rural nursing is all about and living in a community like this. And it's a great way for us to also potentially recruit the wonderful students that they have.
My name is Janae Wren. I am a new grad from OHSU. I have accepted a job at Harney District Hospital starting in August, and I was lucky enough to be a recipient of the Oregon Rural Nursing Scholarship. During my time as a student nurse at Harney District Hospital, the one thing that I loved most about being here was the acceptance and willing to educate throughout every individual that is in this hospital, as well as being able to step foot outside and get into nature. I was born in Central Oregon, however, my family was all born and raised here in Harney County, and I had decided it would be extremely beneficial for me to start my career in nursing here. Burns is an extremely small and tight-knit community, which has a lot of benefits. You don't get to go anywhere without seeing at least a couple of people that you know, and it's something that I truly love about the area because you're never left alone. If you need anything, there's always going to be someone that's willing to help, and we support our youth. I think Harney District Hospital is unique in a lot of ways, but one of the largest for me was them allowing the ORNS to step foot and let me do my IP here, as well as having everybody in the same unit from PT to RT, all of the MDs on board, and we meet every day and talk about our patients, so it really gives cohesion in the care that we're providing, and everybody's so willing to educate. There's no judgment, and that's not something that as a student nurse you get to see every day, so I think I was extremely blessed being here. I think in rural nursing we see a lot of different things than urban nurses. We see more things like farm accidents, hands stuck in equipment, horse wrecks. As far as disease processes, I feel like that's all within the community you're in and what's happening there. I think in small rural areas such as Harney District, it's not uncommon to treat individuals that we know. I remember one time I had taken care of a patient, and later that month I had seen them in the grocery store and they had came up and thanked me, and it's just an extremely rewarding feeling having a full circle moment like that, because a lot of times you don't get that at bigger places. I think it was extremely beneficial for me to go to OHSU School of Nursing. It was my top pick and I was lucky enough to get in. During my time on the Klamath Falls campus, I had amazing instructors who advocated for anything that I could have asked for. This was how I ended up here at Harney County, and they had given me the opportunity to apply to the Oregon Rural Nursing Scholarship, which, led this whole journey here. The Oregon Rural Nurse Scholarship really allowed me to dive deeper into my studies and not worry so much financially about what I needed to do. I was actually able to not work during my last year of nursing school. It allowed me to move to Burns to pursue more rural nursing, which is something that I'd been interested in since before I'd applied to the nursing program. I also had the opportunity to go to the WIN conference to learn more about what other nurses are experiencing and diving deeper and learning more about what rural nursing looks like to them, because to know one rural community is to only know that one. So it was extremely beneficial, and I was able to take those things into the practice that I'm going to be having here.
Hi, my name is Julie Epling. I am a staff nurse at Harney District Hospital in Burns, Oregon. Rural nursing is different than city nursing because rural nursing provides you daily opportunities of different types of nursing. You can be in the ER one day, OB the next, ICU, or even a mixture in the same day. City nursing, oftentimes, you're in one specialty in one department, and although that provides you a great opportunity of nursing skills, it's a little bit different in rural because you do it all. Harney District Hospital is unique in the sense of being a rural hospital, and when I think of nursing care, it's kind of the buck stops here. We are the code team, we are emergency transport, we are everything. We don't have specialty teams to call in, it's us, and we know that. In rural healthcare, one of the things that I've noticed is it's a thoroughfare for travelers, and oftentimes we get people who are traveling through that have no idea about Burns, Oregon, our hospital. They're here in an emergency situation, devastated, terrified, and it's really nice to see all the people come together to support the patient, not only physically, but emotionally and with resources that they need to get back on the road or get back home. A typical day for me, since I'm on day shift, starts at about 6:45 in the morning, clock in, get report in the morning with the staff coming on for the day. At 10 o'clock, we have a huddle with the doctor, PT and OT, nutrition, pharmacy, our case manager, our CNO, charge nurse. When I'm not at work, I like to be at home. I like to garden. I have a lot of chickens. We like to spend time outdoors and camping. We have the hot springs, a lot of trails out here, the mountains, just a nice place, a lot of diversity, different things to do. It's extremely rewarding to be a nurse in a rural area because oftentimes you get to see the people you've taken care of and see their improvement out in the community. And when people see you out in the community and you've taken care of them, they'll come up to you and talk to you and thank you for the care that you gave, and you see them up running around again, and that's what's so rewarding.
I'm Tamara Rose. I'm an Associate Dean for Statewide Undergraduate Nursing at Oregon Health and Science University. In my role as Associate Dean, I have the privilege of occasionally being a clinical instructor. I'm a rural nurse myself, and I grew up in a very small rural community. It's really fun to hear them, when I come out and debrief with my students, to hear them talk about what their day has been, what their week has been since I've seen them the last time. OHSU School of Nursing was awarded a grant to support nursing students in the rural setting, and the focus of the grant is acute care and long-term care. We have been able to support, in this past year, 13 scholars in the program, which allowed them to spend specialty time and hours in addition to their curriculum doing very focused rural learning. They've been participating in some seminars. They're learning about the aspects of being a rural nurse, while going to school and taking their regular curriculum. The scholarship allowed them some additional funds so they could travel to the critical access hospitals that are in far-lying areas of Oregon. My student, Janae, her clinical site was 230 miles away from our school. So she came and lived in the rural setting in Burns for 6 months while she was still attending school in Klamath Falls. But the scholarship has been really great to add that aspect of rural nursing and just give the extra hours to the students and the extra education so they can learn and hopefully want to be in a rural area after they graduate.